Hello, both sides of the conversation family. We welcome you to this virtual space crafted especially for you. My name is Jada Curry, and I'm both sides of the conversation's marketing director and graphics design specialist. I want to take some time to ground us all as a community into this space we are about to open up in, so let's go through our community standards. Both sides of the conversation is providing a safe and honest space for open conversation, so we ask that you all be respectful of that. We also ask that you be respectful of each panelist, host, and participant. We do encourage healthy debates and conversations. Don't personalize anything with anyone. This includes name-calling, bullying, trolling, or shaming. This will not be allowed or tolerated. Your perspective is yours. It is not a prescription. You do not have to agree, but show respect. These community standards apply to all of our live shows and any virtual spaces that we hold on social media, including YouTube, Facebook, Twitter, or Instagram. We want to make sure that we are caring for each other as a community. This is our priority in all of our endeavors as both sides of the conversation. With that being said, I hope you enjoyed today's show and continue to stay in touch with us via YouTube, Facebook, Twitter, Instagram, or all of them. All right, thank you for listening and see you soon.
Welcome, everybody, to both sides of the conversation. I'm John Henry, Executive Director. Today is Thursday, so you know what that means. We're going to have another educational presentation as we've been promising community all year. This year, we're going to be talking about health and wealth in our community. And tonight, we have a phenomenal doctor that's going to come on and talk to our community about HIV and STIs in our community and talk about some of the important work that he's doing to impact our community with this research. So we'll be getting to the presentation shortly, but just want to say, this is our first show of March. As February Black History Month was a very powerful, impactful month. A lot of events, presentations, and education that took place that last month. Just excited of how things went. And just looking forward to the things that we're going to be doing to move forward as a community, as we're going to celebrate Black history and some of the work that we are doing now currently throughout this year. So just excited about that. It's been an up and down month. We had our bowling event, which was a success. A lot of things happening. Just grieving, going through the process of the loss of my mom, but just happy days ahead, a lot of great things happening. And today is my granddaughter's birthday. So I want to make sure that I say happy birthday to my grandbaby TT, 6 years old. Just happy. It's been a lot of ups and downs, but just to see her develop to this young, amazing girl and just watching her brought smiles and some happiness to me today. So I've been excited and pumped up. So just can't wait to get into the weekend festivities with her because that's what it's about, family. Y'all know here at both sides of the conversation, we about community, family, and making sure that our loved ones is uplifted and appreciated. Also, want to salute and say, hey, it's Women's History Month. We're not going to forget about the amazing queens of our community that continue to impact and uplift our community. We have some phenomenal historians that we're going to be talking about throughout the month. And just acknowledging those powerful sisters who are doing some amazing things, especially our lovely Mayor London Breed and some of the amazing sisters that are breaking the barriers and making history. We know President Biden nominated an African-American woman federal judge. So it's great things happening for the women in our community, and we want to celebrate and uplift them. Also want to give a huge shout out to our sister at SF Black Wall Street. Want to give a huge shout out to Tiffany Carter, as she is now one of the new San Francisco commissioners for the small business. So we are just happy to see what is going on. Way to start off Women's History Month with some community women doing some very important, impactful things. So shout out to you, Commissioner Carter, and all the endeavors that you are doing to impact our community, and to all of our sisters at SF Black Wall Street. Very, very important to continue to empower the folks in our community. So just excited about that. Also, the last day of Black History Month, we was able to honor Jack with 35 years. Our Mayor London Breed honored Jack 35 years of service, working in our community, doing the work. It was an honorable event, and just happy to walk on side of him and all the amazing work that he's been doing to impact the Black and brown community over the past 35 years. So salute to Jack. Thank you, Jack, for all the work you do in our community. And then the organization Alive and Free Omega Boys Club celebrated their 35 years of service in the community with 256 college graduates, Dr. Marshall, and a number of phenomenal folks down there that's just been impacting our community. So just want to give them their kudos and love and support as well. Want to give a huge shout out to the SF Rebels, Nate Ford, and all the amazing stuff that they're doing with the young folks. He's been posting a lot of successful things that they're doing to impact the community. So I want to give a huge shout out to the SF Rebels. And then our Brown Bombers. Don't want to forget about the Brown Bombers. They got a phenomenal event coming up to acknowledge community at their banquet tomorrow. We'll be out there for a little while before I go to my granddaughter festivities, but want to just give a huge shout out to Raymond Ross and to the Brown Bombers family for continuing to support both sides of the conversation and all the amazing work that they're doing to impact the families and our young kids in the community. So with that being said, we're going to jump into a little bit of the world news and get started for tonight's Educational Thursday presentation. There's a lot of changes and things happening here at both sides of the conversation. Please go to our website, follow some of the updates as we continue to grow as an organization. There's a lot of hurdles and things that we're trying to overcome, but we'll get there because we love the people. We work for the people. We grind for the people. So we'll get there with the support of you all. As many of you know, the war has started in Russia and Ukraine. A lot of our African brothers, Nigerian brothers and sisters have been impacted by this war. Many 9 refugees fleeing Ukraine was caught in limbo as they were trying to cross the borders. A lot of them have been reporting discrimination in Russia and Ukraine. A number of Nigerian students was complaining that they were being left behind as their counterpart whites and actual animals were allowed to board trains to get out of Dodge, and they were stuck there. A lot of families, young kids in that cold weather. So, just to our community, just know that when we talk about systemic racism and how our people are being impacted, even across this world, our folks is still being impacted in the time of danger. And just want to put that out there, because so many times people act like, these type of things don't happen. And even today across the world, not just here in the United States, our Black folks are still being impacted by systemic racism and things of that nature. So very, very sad to see what's going on as Russia continues to attack and demolish Ukraine and going through their cities. But we're going to continue to pray and uplift those families and to those young folks who are out in the freezing cold for 3 or 4 days, no food, in despair, not knowing what to do. We're going to continue to uplift and support them as much as we can here at both sides of the conversation. And community, you could do your part as well to uplift them in prayer and make sure that if you have family or loved ones who are impacted, definitely reach out to them. Also, Mayor Bree would like to back down to bringing folks back to work again. As you all know, this COVID, the numbers have been dropping, and the mayor is proposing bringing back some of the financial district, some of those folks down there that's been working remotely as the COVID cases are dropping. So things are starting to come back. We're not out of the woodwork yet. We are still getting positive cases and things are happening, but the hospitalization numbers are dropping. And, there's still danger out there. So we still want folks to be safe and, just be mindful as we're coming back. The freeways are going to get packed as people are coming back to work. We know the traffic. We've been having a number of freeway shootings and highway road rage shootings, not only here in the Bay Area, but across this country. Please, folks, take time, be patient as the roadways are going to start getting increased with cars as more and more folks are going back into the offices. So have patience, leave early, and try to adjust your commute so that we don't have any more road rage incidents, people getting frustrated, people cutting them off. So just wanted to put that out there. For our community events, a number of events taking place in the community. Every Friday night, they are still having the night karaoke. Every Saturday at Cafe Envy, 1701 Yosemite in San Francisco. The doors open at 6 p.m. to 11 p.m. DJ Hyphy will be in the building. They're going to have food and drinks for community as we start getting back into community. Definitely, that's a place to go check out if you want some culture and some of the folks in D10. Amazing food. And it's always a great, fun crowd out there. So if you get a chance, go out to check out the night karaoke at Cafe Envy. Also, our Bayview Senior Services is hosting the 42nd annual Black Cuisine, which is happening. The pickup is at 1753 Carroll Street at 3rd, or they can deliver. That'll be happening Friday, 2 p.m. to 5 p.m. That will be tomorrow, or you could do Saturday, 11 a.m. to 4 p.m. We'll put the order information up there. Again, they have some amazing chefs down there, and a way to support our seniors and our folks that are at the Bayview Senior Services. Please go and support them, buy a meal, as they're going to be providing those cuisines for the community this month. Also, the KIP Bayview Academy is hosting a free COVID vaccine clinic, which is happening at the Academy on 1060 Key Avenue. It's happening Thursday, which is today. It was happening from 2:30 to 5 p.m. So I know some folks was getting out there, but just want to let folks know there are still places you can go to get COVID tested and get some of that support services out in community. California State Parks at Candlestick Point SRO Winter Bio Blitz is happening Sunday, March 6, 2020. You have to register. This event is a bit.ly event. We'll put that link up there. We'll be putting it on our social medias if you'd like to join that event. It is a registered event. The Blackwell Black Hawk Evening of Paint and Poetry is happening Thursday, March 17th from 6 p.m. to 7:30 p.m. It's at the Tenderloin Museum, which is 398 Eddy Street in San Francisco. If you'd like to be a part of that event, go check it out. Should be some cool stuff with painting and poetry, as poetry always moves the people in the community. The Pear Tree Community School Black Futures, Friday, March 11 is happening from 6:30 p.m. to 8:30 p.m. at 2150 Levinson Street. That is happening in Oakland, California. As you know, in Oakland, they are still fighting about the closure of schools and a number of other topics and issues that impacted families and our young folks in the schools. So please go be a part of that. Some of the upcoming both sides of the conversation announcements we want to get out there. If you would like to support us, we need continued support from our community. Please shop on Amazon Smile. Choose both sides of the conversation as one of your charitable organizations. No extra cost to you, but every time you purchase something on Amazon, they will make a donation to our organization if you choose them. So excited about that. Also coming up, check out the airwaves, as we will be putting out some information for community. We are partnering with Kaiser Permanente. We're going to be doing a financial literacy series, about a 3.5-hour series. We're going to actually pay community stipends and provide them with a lunch to come to this financial literacy program. If you would like to be a part of it and you want to sign up, please sign up, as we're going to be distributing all of the flyers throughout the week here. We are putting all the information together, or you can reach out to us at events@bsotc.org, or you can reach out to us at info@bsotc.org. If you would like to be a part of it, there is going to be a seating limited, but we have room for folks. We're going to have some phenomenal financial coaches that's going to come on as well and talk about a number of things in finances, as we are going to continue this year to keep promoting our health and wealth in our community. We want to bring some financial freedom to our community, and we want to bring some economical power to our community. So we are excited about that. This Sunday, there will not be a Sunday conversation, as we are moving. This Sunday, it is a Sunday conversation. We will have San Francisco Board President Shaman Walton. He's going to be coming on to talk to community about the budget updates, some of the updates that's taking place in the community, talk about some of the things that he's been doing, some of the ballots and things that's coming up. So we're going to have a great conversation with Brother Shaman Walton, Supervisor of District 10, and also San Francisco Board President. That's going to be happening this Sunday at 2 p.m. We'll be talking with Brother Shaman. And then next Educational Thursday, we'll have Erica Scott. She's going to be coming on March 10th to talk about Black culture, and we're looking forward to that. And then next Tuesday, we'll have another segment of our Hidden Gem segment, where we will continue to highlight our Black and Brown businesses, as well as those community leaders and organizations that are doing positive things to impact our community. Also, with that being said, we here at both sides of the conversation has a limited amount of in-home COVID testing kits. If you would like to get in-home rapid testing kit, for your house or for your loved one, please reach out to us and we'll make sure that we get you some. We are moving them out into the community. If you're looking for some COVID tests for your home, please reach out to us through our social media handles or on our website, or you can email us at info@bsotc, and we'll make sure that we get some of those kits out to you as soon as possible. So we're excited about that. With that being said, I'm going to close my mouth now. I've said enough for tonight as we enter this first session of education and awareness of this month on this powerful Women History Month. We're going to have some questions tonight, I know for sure. But with that being said, we're going to bring up tonight's guest, our panelists tonight that's going to educate our community about HIV and STIs. We're going to bring up Dr. Hyman Scott. Brother Hyman, welcome to Both Sides of the Conversation. Thank you for having you here tonight, my brother.
Thank you for that introduction, John. I appreciate the opportunity to be here and share some of the information that we have here in the health department around HIV and STIs. So my name is Hyman Scott. I'm a physician by training. I'm in the San Francisco Department of Public Health. I do primarily research on HIV prevention, as well as I'm a provider for HIV care at Ward 86 and the medical director of the San Francisco AIDS Foundation. I'm also on the medical staff at EBAC, the East Bay Advanced Care in Oakland. So I have an opportunity to really be in the community and always excited to share data and information back with the community for feedback. So I'm going to have about 30 minutes or so to talk through some of the data we have around what's happening with HIV and other STIs in San Francisco, as well as some of the strategies that we are considering and implementing to try to address some of the disparities that we have in both of those. So I will be happy to take any questions, I guess, towards the end. If you have questions, feel free to pop them in the chat. And we can always go back to any slides if there are things that come up that need more clarity. All right, so this is what what I'm planning to touch on today is the impact of COVID-19. It's impacted all of our lives in many ways, and it has also impacted our healthcare systems. And one of the strongest foundations of our work in the health department is screening, prevention, and care. And we are proud that we are one of the best places in the world for those. And so COVID-19 has impacted those. We'll talk about some of the epidemiology, what are the cases like, where are we going, where do we need to go, and then some of the initiatives to address disparities that we have in our communities. So we've seen this with many diseases where my focus has really been on HIV and STIs, but it's not unique to those. We've seen this with in our communities where HIV, hepatitis C, and STIs are disproportionately high. There also were disproportionately high levels of COVID-19 infections and deaths. And so we've really learned a lot from what we know happens with other communicable diseases like HIV and Hep C. And then when shelter in place went in March of 2020, everyone really responded and sheltered in place. And if they were able to, I was also an essential worker, so I continued to go to work, and many of us did. But many of the community-based organizations and clinical sites shut down and moved to telemedicine. Many of the staff who work in our public health system were redirected to respond to COVID-19. So not only were clinics closed, but the people who were in those clinics were also doing work focused on COVID-19. So it really siphoned away a lot of the structures that we needed to respond, to maintain the response that we've developed over the many decades for HIV. And so as a result, we've seen a lot of people didn't get tested because it wasn't possible to get tested. So we saw drops in antibody testing, viral load testing, as well as STI testing all over the city. And we were concerned around how this would impact disparities, as those communities disproportionately impacted by HIV and other STIs might also be disproportionately impacted by this change in access. So what did we see? So this is a graph in the orange of chlamydia tests. In the green are syphilis tests. And in red are what we call pooled HIV viral loads. So these are ways that we monitor for early HIV infections. And you can see right around March, there was a tremendous drop from about 2,000 tests to under 500 for chlamydia and syphilis, and then dropped down actually quite near to zero for the pooled HIV testing. And then we saw these numbers come back up as things have opened, but they haven't returned. This is through August of last year, but they haven't really returned back to where they were before the pandemic in many of our clinics. And so this is still a real gap that we're trying to recover from. And where are we going with our HIV diagnoses? So every September, there's a report that's put out, which is our epidemiology report around HIV. And it provides information around diagnoses, deaths, and the number of people living with HIV. And we track this over time. And as you can see in the green line, those are the new diagnoses. And so we had a slight slow decline in number of diagnoses until about 2012. And then you see that the slope of the line just gets steeper. So we see more declines. In 2019 was the first time that we were under 200 cases of HIV diagnosed in the city. And then in 2020, there's always a lag in the number of cases. There was about 131 cases. So it's continuing to decline. We are concerned that this decline is because people weren't getting tested as much, and that's an underestimate of the number of cases. But we'll know more, I think, as over the next course of the year. And then the purple line are the number of deaths, and we really have not seen a change in the number of deaths among people with living with HIV. We've also seen that there's a relatively stable number of people living with HIV, which are the tall yellow bars. And this is really a reflection of two things. One, people with HIV are living healthy, long lives with HIV. So you'll see in the early 2000s that the bars get taller. And then they've been leveling off as we've had fewer diagnoses. And so we have in 2017 was actually the first time that the number of diagnoses was fewer than the number of deaths that we had of people living with HIV. So we saw a decline of about 22% from 2019 to 2020. Deaths have been pretty stable. And just to comment that more than 70% of people living with HIV are over the age of 50. I mean, we've seen quite a few people leaving San Francisco who are living with HIV, which is reflective, I think, of what's happening in our community more broadly with outmigration. When we look at this by gender and race ethnicity, these are adjusted for the population. So we know that the Black community, the Black population in San Francisco is small, so smaller numbers represent a larger proportion of our community. So this is adjusting for those differences in population. And so these are the rates per 100,000. So among Black men, it's 84, Latino men is 58. In Black women, it's actually 22, which is higher than among white men and Asian Pacific Islander men. So we've seen this sort of general decline in number of rates of diagnoses, but we haven't seen a closing of the gap. And I think that's where we really are trying to focus our effort, is we want to ensure that equity is achieved and those gaps are closed. When we looked at other populations more broadly, so those were by gender and race ethnicity. So if we look at overall, these are number of cases. So remember 2020, there's 131 cases. So 49 of those cases were among Latinx individuals, 37 were white, 27 were Black. And the numbers are reflective of where the trend has gone. So for 2020, we actually saw an increase among the number of women that were diagnosed with HIV. And it went up almost 30%, as well as for heterosexual and people who inject drugs. Other groups have seen a decline. But this really highlights areas where we need to focus, particularly among women, as we've seen this absolute and percentage increase. And when we look at deaths, so the rates, again, adjusted for the size of the population, we see that there has been a pretty stable rate of mortality among people living with HIV in our communities. There is some fluctuations that we see over the years. And then in 2017 and 2019, we've been able to include mortality rates for trans women. These are not age adjusted, so we know that 70% of individuals living with HIV are over the age of 50. And so we adjust for age for all the populations. This was not age adjusted. We hope to have that in the next report, but that's just a caveat for that line. So that line might not be reflective of the same criteria that the other lines are in this graph. One of the things that we really try to do when somebody is diagnosed with HIV is offer them immediate access to care. So we really try to get individuals after they're diagnosed linked into care very quickly and access to medications if they would like them right away. Same day is preferable if it's possible. So these are different years from 2016 on the left in the sort of yellow to 2020 in the purple. And so of the people who were diagnosed, the number who were linked to care within 1 month, it increased from 2016 to 2019 and sort of flattened out. We were above 90%, but our goal is to get everyone into care within a month. We saw a slight drop, and we also saw a drop in the number of people proportion of people who were virally suppressed. With our current medications, it's actually should be quite easy to have somebody suppressed within a year of starting treatment. And so seeing this decline back down to 70% is somewhat concerning. This is another way that we sort of think about how well we're doing with keeping individuals engaged in care and their viral load suppressed. So one of the things we think about is like, what is a community viral load? So what is the viral load within communities that will impact the health of those individuals living with HIV, but also the potential for transmission among individuals who are not virally suppressed and have a viral load at a level that can be associated with transmission. So this is, again, looking at different populations, and in blue is 2019 and in orange is 2020. And so the blue line shows where we were before the pandemic and the orange line during the pandemic. And we saw a decline. So we saw fewer people being virally suppressed. So more people who have detectable viral loads. And then when we look at populations, almost all the populations that had that were below this blue line are also below this orange line. And we've seen a drop in viral suppression among all those communities as well. So disproportionately impacted continued during COVID-19. And so this has really been a focus of why we share these data, so we can know where we need to focus efforts for equity. Housing is also a tremendous determinant of health. We know that housing is care. And so looking at individuals who are unhoused in San Francisco, we can see that in 2020, only 33% of those people who were unhoused were in care. 20% were viral load and had a viral load that was suppressed, and about 60% are suppressed if they were in care. And so there's a lot of people who are out of care, likely driven by competing needs, particularly with housing insecurity. We've been trying to integrate our work with HIV also with STIs. So we've been tracking our STI rates and like to share those in tandem when we're sharing the data from the city. So these are the 3 bacterial STIs, so chlamydia, gonorrhea, and early syphilis. You'll notice that the numbers are slightly different. The scales are different. So syphilis is at the top, but it's actually the lowest number per 100,000. But between 2016 and 2019, we saw sort of a general increase. So syphilis rates were going up the most to 34%, chlamydia and gonorrhea were going up about 12 and 16%. And then from 2019 to 2020, we saw them all drop. And we don't think necessarily that was just because there was less gonorrhea or less chlamydia in the community, which there may well have been as people's sexual behavior changed in response to the pandemic, but also that we know that there was much less testing. And so it's probably somewhere in the middle. But we saw massive drops, significant drops in a year that the year prior we had actually seen increases. What we didn't see a decrease was, unfortunately, in female syphilis cases. So that actually increased from 2019 to 2020. And it actually went up almost 200% from 2017 to 2020. And the concern with women acquiring syphilis, particularly women who can become pregnant, is the concern about congenital syphilis, an infection of the baby. And African-American women were disproportionately impacted by syphilis, disproportionately diagnosed with syphilis in our communities. It was 34% in 2020. We saw a concerning increase in the first part of 2021 as well. So what we've seen is HIV and STI syphilis, HIV and STI testing declining significantly in 2020. 90% of STIs are asymptomatic. So if we're not screening, we're just missing diagnoses, and we know that we weren't screening. Overall diagnoses for HIV have continued to decline. We see our Latinx community having the highest number of diagnoses, and we've seen the smallest decrease in diagnoses among African Americans and Latinx communities. Cis women have seen about a 30% increase in HIV diagnoses, as well as an increase in syphilis diagnoses. And while we didn't see any perinatal HIV transmission, there was 5 congenital syphilis cases, including one infant who died as a result of syphilis, which is a preventable infection and preventable death. So overall, we've had high levels of linkage to care and viral suppression, but there are clearly communities that we need to support more in engagement and support, especially those who are experiencing housing instability. So how are we addressing these disparities? There's a variety of approaches. We are part of an effort called Ending the Epidemics, which is really to reduce our HIV infections by 2025 and 2030. This is, we've focused this within HIV and expanded it to Hep C and STIs. So integration of our care, centering it on health equity and racial justice, supporting individuals regardless of their status, what we call status neutral, making services available, and really supporting a peer-driven and community-driven activities. We really, stigma and discrimination are really poised to undermine a lot of our efforts to achieve health equity and services within HIV and STIs, and really focus on harm reduction as well. So these are some examples. So there are these status neutral services, which are through jail health, gender health, and expanded street medicine, whole person care outreach team. There's a mobile contingency management, which is a street-based team focused on supporting people experiencing homelessness, as well as BIPOC communities who are report smoking fentanyl. And then there's home testing programs, a text-based reminder, web-based and telehealth services to expand care services out beyond our brick and mortar locations so that individuals can access services regardless of where they are. We focused on mini grants to support increased dialogue and to advise on service design. We've advanced workforce development as well as supported regional planning. We know that people who live in San Francisco might work in the East Bay or the Peninsula or play, and vice versa. I live in South of Market neighborhood, and I can get to West Oakland faster than I can get to the Sunset. So we know that our communities are intricately linked, and that we need to collaborate in order to get to a better place. This is an example of some of the collaboration. This was a San Francisco Reproductive Justice Summit that was really planned pre-COVID and was delayed and moved into a virtual setting, but is focused on bringing together individual community members from the Black African American community and healthcare staff to really focus on challenging anti-Black racism within the sexual health care and developing actionable recommendations. And so there were 160 participants, 63 of whom identified as Black. And there was healthcare workers from both UCSF and DPH, and staff from organizations including the Unified School District and CBOs. And really the recommendations that came out of the summit were really community collaboratively based and really focused on these areas: trustworthiness, respect within settings and within visit structures, ensuring high quality of care, supporting self-advocacy, having a focus on sexuality and pleasure within reproductive health, holding staff and clinics accountable for what happens within those clinical spaces, as well as holding the systems accountable and focusing on change. And really trying to move forward, addressing the issues that are existing within our systems and preventing individuals from wanting to come back in many cases so that we can all get to a better place. So this is an example of some of the work that has come up from community engagement. And in particular, one of the comments from the summit was talking about sex and pleasure. So this is the social media campaign that is on Instagram, YouTube. There are some Comcast ads as well. And it's really about have good sex. And there's some varying types of fruits with very colorful, engaging, fun imagery that is really around being sex positive and talking about the pleasure and the fun of sex. There are social media influencers. So these are 3 of the influencers who are also part of this campaign and are part of the ads focused on really raising awareness and destigmatizing. This is another campaign that was really focused on PrEP. And so really talking about what PrEP supports, and not talking about PrEP is for individuals who are at high risk for acquiring HIV, but really talking about PrEP supports your freedom to be powerful, to be brilliant, to be creative, to really all the positive reasons why somebody would want to be on PrEP. And these are some data from the San Francisco City Clinic, which has a very robust PrEP program, and the increases that we've seen in PrEP uptake among those clinic attendees from 2014 to 2020. So upwards of 60 to 70% of the men who have sex with men who attend that clinic are on PrEP. And you can see the racial breakdown. So we've seen increases among all groups, but we still have a gap between African American attendees and other racial groups within that clinic. And that's something that we've seen in other clinics as well. And so really focusing on is there something about the space, the perspective, the experience of the individuals who decide not to take PrEP different, and is there something that we can change about the way we do things? And there are people who just don't want to be on PrEP, and that's fine as well, in supporting people's individual choice. So as part of this effort, one of the things that we've tried to do, and this really came out of the community, is our goal is to get to zero. So to get to zero HIV infections, get to zero HIV related deaths, and focusing on this collaborative impact, a collective impact, where we really have a backbone of coordination, tremendous community engagement and support, data and feedback of the data and accountability so that we can refocus our efforts. So really it's about what we've shifted for in the next 4 years is really reaching people at risk through testing, low barrier services, new agents like long-acting treatment and long-acting injectable for prevention, and then respond through efforts to engage people quickly back into care. There's a pop-up program that's based at San Francisco Hospital that allows individuals to get walk-in care if they're unstably housed without making an appointment. It's just easy access. And then supporting services, so mental health support groups, housing services, providing multi-disease screening and linkage. So I think some of the work that we're doing with COVID-19 and offering testing for HIV or Hep C or STIs integrated into those testing. And then this is all centered on equity and justice. And so that's a metric that we measure. And as you've seen through the slide deck, it's really focusing on the communities and populations within our city that we need to provide more services or different services or differentiated services so that we can access, so people can access it as they need. And so as we move towards this new phase of COVID-19, where it goes from this pandemic that shuts down the world to an endemic where we are living with COVID-19 in our communities, in our lives, we want to make sure that we have an opportunity to respond to the HIV and STI needs as well within our communities. And so looking forward to answering any questions, and thank you for the opportunity to share some of the data from the San Francisco communities.
All right, great information. I know there's a number of important meetings happening right now. The comments are low because they got emergency redistricting meeting going on. They got a budget meeting going on, and the school district has a meeting going on. So I know people are out there, but I definitely had a number of questions that I wanted to ask. As you know, you talked about the numbers increase in our community, and COVID has kind of really impacted the way folks go get maintenance and care. Now that we're getting close to endemic, as you were saying, or getting out of it, how much are the hospitals and organizations ramping up to get back into the community to help support these services that our community really needs?
Yeah, so I think that folks are coming back into the clinics now. I think everyone, as people are able to go to restaurants and to into bars without, as they're vaccinated and now without masks. I think people are coming back into clinics, and clinics are expanding. There is a refocus of services back to hopefully back to where we were in 2019 and expanded. And so we are seeing increases in some places, particularly around care, and there's more catch up. So there's actually higher testing than there was before COVID, just because people are behind still. But I still have patients who are still sort of afraid to come into the clinic because they're afraid of COVID. And I was like, well, this is probably the safest place for you to be in clinic because everyone's screened, everyone's masked, everyone's, the staff are vaccinated. So, and our community transmission has gone down dramatically.
That's definitely great information to hear. Now, before the pandemic, there was a campaign from DPH and a number of organizations. They was like out in the community passing out, condoms and having different pamphlets and information and access to local free clinics. Do you know is that something that you all planning to get back into our community since the Black and brown communities being impacted so much?
I think so. I think it's a great question. We've had this conversation of like, what you used to do in the past is you would just like walk up to people and talk to them. But now with COVID, that's like taboo to do. And so I think that we haven't gotten quite back to that where just random people coming up and having a conversation. But I think we're getting close to getting there. And, the Pride is going to be back. The carnival is happening. So there are these large gatherings that are happening outdoors. And so I do think that that will be returning. That is a cornerstone of our community outreach and education. So we will have that returning, I'm sure.
Wow, that's gonna be great. I mean, it's much needed, as you know, those numbers are very alarming, to see those type of increase. And we know COVID has just kind of took over all of the medical news. And just to have you come on to kind of really highlight that for community and bring that education and awareness, I think is very important, especially with our young folks in the community, letting them know that, hey, this stuff is real, still passing out. But I wanted to ask you about, because I've seen a number of articles and stuff, going around social media. When we talking about HIV, there was, I don't know if it's a full cure, but they said there was a couple Black women who were cured of HIV. There's been buzz and talk around UCSF about stem cell curing. Can you talk a little bit about that? If you know about it, is it just social media stuff?
No, it's real. It's one person that was one woman that was reported. So it was reported at a big conference called the Conference on Retrovirals and Opportunistic Infections, or CROI. It's often where these cases are presented for the first time. So it was a woman. So there have been 3 cases reported. All these individuals have some type of cancer for which they needed a transplant, like a bone marrow type transplant. This is the first woman. So the other 2 were men. And this person was of mixed race. And so she received a cord blood transplant. And the significance of gender and of race are that finding a match can be sometimes difficult. So you'll see campaigns for bone marrow transplant matches for Black and brown folks, because it's sometimes harder to find a match that won't cause problems. And this transplant included a genetic, it's something called a CCR5 delta 32, which is a long scientific name for it's sort of cells that are resistant to getting infected with HIV. So she received cord blood that had this genetic profile that made her new immune system resistant to becoming infected with HIV. And that's what happened with the other cases as well. And so it was one woman, and it was in the U.S. and she was a mixed race. So those are 2 of and it was like only the 3rd case that's been reported. So those are the things that make this really newsworthy. But it's not a strategy that we can use, because the risk of dying from that transplant is actually quite high. Whereas people living with HIV live very long, healthy lives with the regimens that we have now to treat, which are very safe.
Wow, great. You just wanted to get that information out there, because I know a lot of people, they hear it is and different things. And then, one of the things that, you talked about, getting blood drawn for like bone marrows and sickle cell, different things that impact our community. How do we encourage our community to go and be a part of those blood drives? Because I mean, I'm always hearing we need blood donors for bone marrows, and it's just like something about our community is not registering. So what do you think that trigger is, or how do we get, our community get behind it? We don't want to be in that reactive stage where something impacts our family or someone close to us, and then we like, hey, we need this help. How do we get our community kind of excited, or kind of, moving towards, taking those steps to help impact community?
I think it needs an investment. And I think that investment is time and presence and support. Because, I think that if there's suddenly something that happens and then there's been no establishment of trust, there's a lot of reasons why individuals might not trust, collecting blood and all those things. There's a lot of examples of when those things were not done in ethical ways. And so I think having ongoing relationships and building those community relationships, we've seen this with COVID, like it took a lot to build the types of relationships that I think now exist. But that was an investment. And so I think that's really what it is. I think that the personal impact is a motivator for a lot of people, like having a family member who needs a transplant, knowing somebody who has a family member who needs a transplant goes a long way. But setting up ability for us to have ongoing relationships so that there is a community trust, and people show up for the things that are going on in the community.
Yeah, I think that's huge. I mean, during this pandemic, I've been sending on a lot of these calls, consistency, being there, stopping here, stopping the other media outlets, making you all face available to community to help build those relationships, make a big difference. But there's a question that came in. You see it on the screen if you want to take a shot at that.
Oh yeah. So is there any way HIV/AIDS can be cured by CRISPR? Um, we hope. I don't think that we have a answer to that yet. I know that there are some efforts to like utilize this really cool technology to see if there's a way that we can. We don't have an answer yet, but it might be a combination. It might be CRISPR and something else that might lead to a cure. So it's really hard to cure HIV, as we can see. There, tens of millions of people infected with HIV, and there have been 3 cases of cure.
Wow, very important stuff. Just proud of the research that UCSF continues to drive in our communities, as well as all of the data and research. We have a long way to come in our community of bridging that health disparity gap and just, being impacted in all the areas that impact the Black and Brown community. But one of the things that I really, was thinking about was, how do we get to the point where, these conversations, and I'm glad you had that slide about the safe sex, positive sex thing. When in the Black and Brown community, when we talk about sex, it's taboo, it's stigma. It's like, talk about that, right? But how
Yeah.
do we really educate our community? That's one of the things I wanted to have a conversation about. Because I think when we talk about safe sex, we talk about protecting ourselves in the community, those conversations are not happening. And I think at a larger scale, we really need to have those conversations, not only with our young folks, but families and community folks, because, in the Black and Brown community, so much of the religious realms and different things that impact us. But I think it's a real conversation that needs to happen to help curve some of these numbers, to really educate our community and really get that knowledge. Because you talk to some of the kids, I do a lot of reentry work working in San Francisco Juvenile Hall. And when you start talking about, safe sex, some of the conversations around sex, like a lot of these young folks, nobody in their families talking about it. They don't, you know what I mean? It's this experiment going on. It's not really, diving them into the right direction. And I just really want to put that out there, how we, from a community standpoint, but as well as from the Department of Public Health or some of the research, how do we really drive that type of education awareness to the folks in our community to have those open conversations to really help combat some of the misunderstandings of a lot of these diseases that take place in our community.
Yeah, I think that there are a few ways to think about that. I think our schools are really a really important place for this to happen, and really supporting our teachers and empowering our teachers to be able to do that with kids. I think that there are other reasons why maybe a 12-year-old might not want to talk about sex with their parents. Their parents might not know how to talk about sex with their child in a way that is sort of age appropriate. It takes practice, and I think a lot of the providers that I work with, actually, until you're doing it a lot with patients or with people, it just, using how do you find the right words? How do you describe something without it, with being accurate, but not necessarily, completely sexual. So that it does take some practice. So I think, I'd be interested to know and to hear, like, do parents want coaching and help with like how to talk to their kids and their family members about sex in a way that's not sexual? And so I think that's the balance, and not everyone has the vocabulary to be able to do that, and the comfort level to be able, and like, what if somebody asks questions? Like, there's a lot of reasons why people struggle with it. I do think that there isn't a religious element to it, and as you point out, right, people are talking about it, they're just not necessarily talking about it with all the correct information. And then individuals within the community who are willing and able to talk about it without it becoming problematic. So age appropriate, like, it's okay to talk with a younger child around sex that's age appropriate for them. It's not the same as you're not going to talk to a 6-year-old the same way you talk to a 16-year-old.
Right.
And so it's different language you need to be able to use.
Now that's worth the investment. Now, if we could come up with a pamphlet for our families to have those conversations, or we put together these groups, I think that would be very impactful in our community to help curb some of these numbers of infection. Because I'm talking to a lot of these young folks and they not having a conversation. I'm just gonna be honest. So I mean, probably parents out there don't want to say it, but I think if we could create some pamphlet or some type of scenarios or some kind of education around it, I think that will be something powerful, maybe for the adults or the parents of the community to have like some kind of training or some kind of course on it. I just think the kids that I'm running into and you start having these conversations, they just no one's talking about it, and they're not getting that information. So a lot of choices are being made without really having true guidance of that experience or that conversation.
And I think the other thing to think about is like it's not just like what goes where, but like talking about consent and talking about other things that are really important in a relationship, in a relational sex experience. And I think that there are ways to talk about those things that are also as important and don't get talked about without, you don't even necessarily have to go into like what goes where, when, and with or without a condom. But like, how do you talk about consent and what happens? Like, when do you have the opportunity to remove your consent? And those kinds of things I think are also important. I have a lot of patients who I take care of, and I screen all my patients for, intimate partner violence and sexual violence. And, a lot of my male patients, no one asked them about that, and they've experienced that. And so there are some heavier topics as well that I think that we don't talk about. And then you realize that a lot of people are experiencing this and suffering in silence. And particularly, because we're not talking about it because it's so taboo, as you mentioned.
Yeah, definitely. We're definitely trying to do our part here, at both sides of the conversation, to have those conversations, those difficult conversations, because I think it's real. And I think you hit the nail right there when you talk about Black male health, and we talk about men health and these different things that impact the males of our community that just go silent. Like you said, people don't even ask those questions. And I think that, further traumatize and impact the community and with some of the trauma and some of the stuff that takes place in our community. But being open to have those conversations and getting the right folks, I'm open to that. I want to definitely make sure that these voices are being heard and empowered, because I think, to kill some of that in our community, it starts with having that dialogue and being open with other folks in the community. So very powerful stuff.
Yeah. And I think it leads to healing. There's so much that people go through, and it shows up in other ways. And so having an opportunity to heal each other.
Yeah, definitely. I agree with you 100%. So, when we talk about these disparities, how we're being impacted in the Black and brown community, when we start talking about access, and equity, when we talk about medical services and access to it, due to the high number of unemployment issues, economic, social issues in our community, what is the real investment that you're seeing from that back end, from maybe DPH, UPA, UCSF, to really bring services, to our communities that's, accessible and bring that true equity. Sometimes folks are saying, hey, I don't have the coverage to get there. I know city clinics is open, different things are still providing services, but how do we really advocate for our community folks who, like you said, might be in silence, don't want to say, hey, I don't have that coverage, or just may not know the information on how to get access to the services to get that support?
Yeah, so I think that there are a couple of things. One is that there needs to be a systematic approach to making sure that, where we have services available are where there is the greatest need. So where we, like I sort of think about it like we talk about food deserts, and like where in our communities are there no grocery stores, right? And where those communities are, and those are also the communities where we're seeing disproportionate impact. So, what kind of clinical service is it best to put there? Is it better to integrate it into expand existing community organizations that already have a relationship with the community, and this can be integrated into that? Or is it sort of freestanding sort of clinical services or other types of services or educational. Or, I think one of the things that's happening in Oakland is that the school-based clinics are actually expanding to support the adults that are in the community, right? Schools are a center of community, and they already have the health infrastructure. So expanding that to see the parents, the grandparents, the siblings that may be in that community as well. So I think there's several ways to think about, how to expand it. But I think that now there is a focus on when decisions are being made about where to put services and where to put funding, that it's following our principles of achieving equity. So supporting community-based organizations with clinical services in the communities that are most impacted, in the Bayview, in the Mission, in the Fillmore, in the Tenderloin, where the Navigation Center, for example, is based.
Wow, yeah, that's great information. That's just something that we have to get to as a community. We definitely have to continue these talks when we talk about health and lowering these numbers. I mean, I like the presentation. We want zero. We want none of our community folks to be impacted, and it starts with getting education, awareness, and this information tonight was definitely something to open our eyes to community and understand this is what's going on as people are reconvening and socializing and jumping into relationships. These are the conversations that we want to be comfortable to have and make sure that we're doing the right things, not only to protect ourselves, but to protect others and getting the testing. I guess my last question for you tonight, I know it's been a little while here. I don't want to hold you up too long, Doc, but where are we at with that technology curve? With all of the new stuff that is taking place with technology, how do we get some of these services and utilize technology to help do these testings, or whether more in-home or just more digitally? I know during the pandemic, a lot of doctors were doing tele services, as you said. How do we speed up that process? Because I know sometimes there's always a delay or things, impact us, but how do you see the future of technology incorporating some of this to help get results or make it a little transparent for community to have private more access to it? Or are we there yet, or are we still out? We're still out of ways.
No, there's a lot of movement around making things easier, faster, and more accessible. I think that it seems to me, though, that really it's about choice, right? I have a lot of patients who don't like they like to come and talk to somebody and read the body language and make that connection in the clinic, and it's a place of support. But there are a lot of young people in particular who are like, I don't need to see you and pay that copay when I could do this at home. I need to swab myself anyway. And so they would prefer to do that. So I think it's really about giving people choice, and the technology gives more choices for people, which is what I definitely think is a great idea. So there are home testing for HIV. There's home self-collection where you collect the swab and send it in. You can do finger pricks as well for HIV and for syphilis and send those in. So there are options, and they can be delivered to your house. And the medications can be delivered to your house as well if somebody is on PrEP, for example, or contraception. So there are definitely some new technologies which allow more rapid testing. They're generally in the clinical settings where we could do viral loads, for example. Hopefully we'll have something approved that we could do that at the bedside or in the clinic. We have that actually for COVID. We have the rapid COVID test. So I think COVID has shown us what's possible. Every day we get an update on the number of COVID cases, and it takes 1 to 2 years for there to be an accurate HIV report. So I think that we now know how well it can be done. And then we can use that real-time data to guide us and really focus. So I think that's really also what we need, is to be able to get and be able to respond faster. And the technology can help us do that. But I worry, though, that with all new technologies, those who have the most resources and social capital benefit the fastest and the most. And so we already have disparities, and the technology is not, it's not clear the technology will reduce them. It might expand them, as we've seen with some other advancements. And so we do need to be mindful of how this technology will help us achieve our goal. And now we have a better sense of like, what is our goal? And equity is clearly a part of that. So we have to be careful as we roll things out, like injectable cabotegravir is poised to be a new option for PrEP in our community. Like, who's going to have access to that? How are they going to have access to that? And what does that access look like? Because for people who want it, you know, it should be the same, right? Actually, it should be more in the communities where there's disproportionately impacts so that we have equity. But that's not what's happening. And so we need to really hold ourselves accountable for that.
No, definitely. There definitely was a digital divide. We learned that during COVID when it came to kids accessing Zoom. Our kids in D10 and Bayview could not get on the internet for nothing. They put hotspots. So there's definitely, you know, some learning curves. But just happy to hear that, you know, some of the assessments and some of the things that you all have learned from doing COVID is not off the table, because I think you're right. You know, in America here, especially in San Francisco, we need to be ahead of the curve. You know, we have to get to a point where we're doing more preventative care and services and support instead of reacting to it. And I think, you know, COVID has opened our eyes to innovation and new thought process of how we capture information and data, and how we create these clinical drop spots in our communities to get information and to you know, support community when these type of things are happening. So, you know, definitely looking forward to what the future might hold. I mean, I think, you know, the more, like you said, access that we have, bring some of that equity, you know, to help drop these numbers in our community. I think more people know about the resources, how to connect with them, will definitely be a benefit to our community. Just knowing, I mean, even with the COVID, those test sites, you know, we had Emoja Health and we had Rafiki Coalition and a number of folks who was able to position in the community where, you know, people were like, hey, I'm coming to get these services. And, you know, just find a way to have full wraparound so that folks at different hours, because during the day, folks had access, but we did get a lot of like feedback from community. It was like, man, after 5 o'clock, it was hard to go get, you know, a COVID test. I had to work. So just really, you know, when we talk about meeting community where they at, having a real understanding and dynamic of the community, and making sure that we provide services in an amount of time that really covers the impact of the community, because people do work and not everybody in the community has that access to those times. That was just one of the biggest things, and maybe incorporate that. And, you know, I just want to throw it out there, you know, because one of the things that I'm thinking about and working with some other folks is planning a health and wellness fit day for community. And, you know, that's something that I would like to bring to that, you know, HIV, STI testing to the event, you know, as well as some of the mental health and some of the other things. But I've been getting a lot of good feedback from folks who have been seeing therapy through telehealth. A lot of people like it, the privacy of their home and being able to have those conversations. So I don't know. I think this telehealth is not going away. But again, like you said, bring that equity and that access to all of our communities so that we get it. Because I still hear at both sides of the conversation, mental health is my number one focus for our community. But right behind it is definitely these other health disparities that you talk about that's impacting us. When you see those 70, 80% in those numbers, it's very alarming for the community. And we should be taking this serious as a community. I know we're impacted here in San Francisco with the fentanyl use, like you brought up. A lot of folks are using drugs and substance abuse on top of mental health, and no housing can cause a situation of a crisis. And we have been in a crisis in this city. But thanks to great folks like you, getting out in the community, being a part of the community, and listening to community, and being able to develop and assess to bring those services to our community is just commendable. And just want to say thank you. I've been on a lot of those calls with you, and you know, just engaging with community. That's what it's really all about.
Yeah, thank you. It's, you know, I think we are really hopeful that we can move the needle in the directions that we want it to go. And it can't be done without community. That's been true from the beginning in San Francisco. And I think that we learned a lot during the HIV/AIDS pandemic that we applied to the COVID pandemic. And I think we have an opportunity to learn from the COVID pandemic and apply that to the HIV. And I think this community engagement is really a big, important lesson that we need to apply.
Man, very great information. And hey, utilize us. We'll continue to get this information out to the community. Any updates, any things that y'all want to get out to the community, utilize us to help get out to our community. And like I said, I know tonight there's a lot of folks we got emergency redistricting meetings and things going on. But yeah, we want to utilize this and continue to educate and bring this awareness to our community, especially as numbers increase. We want to be preventative. That's the motto, not wait until we have a full disaster in our community, as we are on most of those levels. We are at that disaster mode right now. But before I let you go, if there's any final words or anything you want to say to community, or you want to, acknowledge any of your folks as a part of the movement, please do it now. And then after that, we'll go ahead and start wrapping up tonight's segment for our Educational Thursday. Thank you again, my brother.
Yeah, no, I just appreciate the opportunity to be here and in community with you and talking about some of the work that we're doing here. So, this is an incredible platform for disseminating information and having these conversations and bringing up things that aren't always talked about. So I'm excited and happy that I was able to join the conversation tonight.
Man, thank you very much. We appreciate you as well. Again, we see the work that you're doing, and just showing up, being that voice for the community and advocating for us is very important. And we just appreciate you and all the efforts that you are doing, and continue to keep pushing for the community as we continue to try to heal and build our communities. So with that being said, community, just want to say thank you all for joining tonight. I know some folks will be catching the replay later on our YouTube channel. We appreciate you. We know there's some very important conversations happening with redistricting in San Francisco, emergency meeting going on right now. We got our school board. There's some budget meetings going on right now. So there's a lot of things happening to impact our community. But just want to say thank you all for being a part. If you have any questions, comments, or concerns you want to bring back, please reach out to us. If you have questions for Dr. Herman, we'll definitely get those out to him via email and get some response to you if you need some support, or if you need any kind of issues related to the conversation tonight. Please reach out to us so we can get you connected and make sure that you have an experience that is needed for you in the community. With that being said, our next live show will be this Sunday. We will be having Brother Shaman Walton come on, the board president of San Francisco Supervisors. He is coming on to talk about the budget update, what's going on, some of the things that he is doing to help impact the folks in D10. Also, this redistricting is going to be happening as well. He's going to have a little bit about that and just some of the things internally that's impacting the folks in our communities and in San Francisco. So looking forward to joining him this Sunday for that. And then next Tuesday, we'll have another segment of our Hidden Gems. It'll be a full lineup next week, as we're going to have SF Rebels and a number of other folks coming on. So we'll be a little long next Tuesday, but we'll get some of those folks on and out of the platform next Tuesday. So just excited about that. Hey, it's my granddaughter's birthday. I'll be out this weekend, community. I know a number of folks have been reaching out to me. It's a number of events for the community that I won't be able to attend because I will be spending time with my granddaughter for her birthday. And so I know a lot of folks reached out to me. I apologize. I can't make it to y'all community events, but y'all know the spirit of both sides of the conversation. Be there, and we'll be there to support you. But this is a weekend that I'm going to be spending with my granddaughter and enjoying her and uplifting her as she is developing into an amazing young flower in our community. A lot of energy. So I'll be doing that. And also we'll be out in the community. There's a number of things that we're going to be a part of. We'll be getting that information out. Also, again, our sponsorship that we have with Kaiser Permanente, that we're going to be doing our financial literacy. Please check us out on our social media handles. We'll be getting those flyers, that information out. You'll have an opportunity to be a part of some amazing financial coaches, get some great financial information. We'll be also paying stipends to the folks who are attending, as well as lunch. So what a great opportunity to get a stipend, learn some information, also get lunch with us, with both sides of the conversation and Kaiser Permanente, as they are doing their part to step outside of the medical realm to make sure that our communities are being impacted with information to help uplift our community. I think this is going to be a great segment, and it's going to be a great meeting to really empower our community when we talk about finances, how to get out of debt, insurance, things of that nature. So I'm excited. We'll be getting that information out soon. Hopefully you'll be able to join us. So stay tuned. Go to our website. Check out our newsletter. We'll be dropping. It's coming. And we'll have that information out there and start signing folks up for that event. But with that being said, thank you all for tuning into tonight's Educational Thursday. Great information from Dr. Scott. I hope you all can utilize this information. Go get tested, go get seen, check out your primary care doctors, and we are trying to curb some of these numbers that are impacting our community when we talk about HIV and STI. So with that being said, all peace and love. See you all. Stay warm out there. The rain is coming through, and be safe out there. We'll see you all. Have a great weekend. We'll see you Sunday for our Sunday conversation. Have a blessed one, everybody.